Please subscribe for latest update for radiology imaging and diagnosis. Today's topic is RGU retrograde urethrogram, AGU anterograde urethrogram. RGU is a special X-ray procedure done to study the urethra, the terminal part of your urinary passage, to look for any abnormalities. It is usually done in males. Anatomy. The male urethra is a narrow fibromuscular tube that conducts urine and semen from the bladder and ejaculatory ducts, respectively, to the exterior of the body. The male urethra varies from 17.5 to 20 centimeters in length and consists of anterior and posterior portions, each of which is subdivided into two parts. The anterior urethra extends from the external meatus to the inferior edge of the urogenital diaphragm, coursing through the corpus spongiosum. Why we done this procedure, that is indication. First is diminished urinary stream. The most common cause of urinary hesitancy in older men is an enlarged prostate. Almost all older men have some trouble with dribbling, weak urine stream, and starting urination. Another common cause is infection of the prostate or urinary tract. Second is urethral stricture. A urethral stricture involves scarring that narrows the tube that carries urine out of your body, urethra. A stricture restricts the flow of urine from the bladder and can cause a variety of medical problems in the urinary tract, including inflammation or infection. Third is urethral diverticular. Urethral diverticulum (UD) is a condition in which a variably sized pocket or outpouching forms next to the urethra. Because it most often connects to the urethra, this outpouching repeatedly gets filled with urine during the act of urination, thus causing symptoms. Fourth is suspected urethral fistula. A fistula is an abnormal hole in the bowel or the bladder. A rectourethral fistula is a hole between the urethra, urinary channel, and the rectum. This hole leads to leakage of urine into the rectum and feces traveling into the bladder. When we can't perform this procedure, that is contraindication. First is acute UTI. Acute cystitis is a sudden inflammation of the urinary bladder. Most of the time, a bacterial infection causes it. This infection is commonly referred to as a urinary tract infection (UTI). Irritating hygiene products, a complication of certain diseases, or a reaction to certain drugs can also cause acute cystitis. Second is contrast medium sensitivity. Immediate reactions take place within an hour after injection of the contrast medium. These reactions can be mild nausea, vomiting, mild urticaria, pallor, moderate severe vomiting, extensive urticaria, dyspnea, rigor, laryngeal edema or severe pulmonary edema, cardiac arrhythmias or arrest, circulatory collapse. Third is recurrent instrumentation. If perform any kind of study in a previous week, after that this procedure is contraindicated. Equipments used in procedure: fluoroscopy, spot film devices for immediate filming, tilting table for any projections without move patient, gloves, syringes, contrast medium, LOCM. Lipiodol, also known as ethiodized oil, is a poppy seed oil used by injection as a radio-opaque contrast agent that is used to outline structures in radiological investigations. It is used in chemoembolization applications as a contrast agent in follow-up imaging. Patient preparation. Patient asked to micturate prior to the examination because we need empty bladder. Preliminary film, coned supine PA view of bladder base and urethra. Technique. The patient lies supine on X-ray table. Using aseptic technique, the tip of the catheter is inserted so that the balloon lies in the fossa navicularis. Lubrication is not recommended. The patient should be reassured about the discomfort that is experienced during balloon inflation. Balloon is inflated with 1 to 2 milliliters of saline. The patient is placed in a supine oblique position. The penis should be placed laterally over the proximal thigh with moderate traction. Then, 20 to 30 milliliters of contrast material is injected under fluoroscopic guidance to fill anturethra. Commonly, spasm of the external urethral sphincter will be encountered, which prevents filling of the deep bulbar, membranous, and orostatic urethras. Slow, gentle pressure is usually needed to overcome this resistance. Films. 30 degrees left anterior oblique, with right leg abducted and knee flexed. Supine PA. 30 degrees right anterior oblique, with left leg abducted and knee flexed. Retrograde urethrography should be followed by micturating cystoarthrography to demonstrate the proximal urethra. Complications. Due to contrast medium. Rare. Due to technique. Acute UTI. Urethral trauma. Intravasation of contrast medium, ESP. If excessive pressure is used to overcome stricture. Thank you for watch. Please like, share and subscribe.